Spinal Hygiene, Part 2. So, before you watch this, if you haven't watched the first part, then I would suggest you go to that. I am going to link it below, so that way you could find it more conveniently. Um, it is it is important to watch that one since it's going to lay down the foundation and the groundwork for what the concept is. Uh, Long story short, you do oral hygiene for your teeth. You brush, you floss, you mouthwash. For your spine, you have the equivalency of that you need to do as a part of just modern day living, since your modern day living puts your body through a heck of a lot of stress, and you need to help counter that as much as you can. Uh, so to start, let's start with core, with the strength. So most people, by a long shot, have weak cores. That's not talking about six packs, abs, or any of that. That is not the goal. And most people, when they think core, they think abs. Abs is just the surface layer of the three layers of abdominal muscles. So we have three layers, and the layer that you really want to think of in terms of your spinal health is the middle layer. The middle layer is the transversus abdominis, TVA, and that is the functional part, not the aesthetic part. So we're engaging this isn't necessarily gonna make you ripped, but it will make you better in terms of overall health. So to engage that, there are different functional exercises. My two favorite ones and the safest ones on your spine are the planks, side planks, and the abdominal vacuum. You could look it up, or I could upload a video if you want in regards to how to perform the abdominal vacuums. There are endless videos on the YouTubes. You could look it up. But again, if you want me to do it, because it'll fill my time, I guess, I could do that too. But you want to be able to strengthen your core on a functional level, just as I said. So start engaging it that way, doing those planks, those side planks. There's an exercise for the back part of your spine called the Supermans. I like that because, again, you want to think all the way around. If you're just doing planks and vacuums, you're engaging that front, and then you're doing side planks, now you're engaging the sides. But to do the back, Supermans are my personal favorite, and most people could do that without complications. There are definitely alternate methods as well, which we could go into detail in future videos if you find that interesting. You just have to let me know in the comment section below. So, strength. Now, the second thing you want to do is flexibility. You want to be able to take your joints into its full range of motion every day. So you could follow, there are hosts of routines. You want to keep it simple. Don't overwhelm yourself. Do not end up doing half an hour of stretches, because you know what? The day where you're rushing to work, or you have a project due, a deadline, an exam, you're really going to spend half an hour? Probably not. You want to actually keep it as minimal and as short and as brief as humanly possible in order for you to adhere to it, because it's not about quantity. It's really well, I guess quality, but you want to be able to do it long term, as opposed to, well, I did 40 minutes today, but the next 3 days I just haven't been able to because I was busy. Like, it's not sustainable. Think short bursts of effective stretches as opposed to long bursts where you might burn out, you might get tired, you might get bored. Now, in terms of stretches, the most important ones for your low back, I would definitely say, is the QL, which is short for the quadratus lumborum, and then the psoas muscle, and the piriformis. These three, beyond a shadow of a doubt, anyone with back complications or setting themselves up for back complications down the line. I happen to find those three muscles, they tend to be really tight. So work on these as a part of, make sure to have emphasis on these three as you do your daily regimen. You could do each side, each muscle group for a minute. So that way, again, you're not complicating your life, but you're really just making the most out of your time. Let's face it, modern day living is busy. So short, effective stretches are better than dragging it out. The last thing you want to focus on is also the ligaments. The most important ligament, or the ligament that I also tend to find very commonly taut and tight in a lot of patients with low back stiffness complications, is the iliotibial band, also known as the IT band. So the IT band goes from the side of the hip all the way down into the knee. And on a lot of you, you could go ahead right now and just start feeling the side of your thighs. And you're going to feel for that band. You could also Google image search it so you could have a visual of what it looks like. And notice how tight that is. For most of you, it's probably going to be tight. It should be as supple as the rest of your thigh and the hamstring. It should be all one seamless feel, but you probably won't feel that way, especially if you have a desk-related job. You do a lot of sitting. So you use a foam roller, you could use tools, you could have the Hypervolt or the Theragun, or a simpler tool like a gua sha tool, which is made out of jade or buffalo horn. It's more of an oriental medicine tool, but you could really just use something in order to work that ligament and soften it up. Again, daily, so that way you could maintain that as well. So there you go. Core strength, muscle tonicity and length, and IT band suppleness. All right. Thank you very much for watching this far in. Please be sure to use your finger bone. Be sure to like, subscribe, share it with your friends, your enemies, and everyone in between, because let's get the word out there. Thank you. This is Dr. AK.